So over the last decades, a lot of publication established a link between microbiome and the patient's outcome after allogeneic stem cell transplantations. In particular, there was a very large study that was conducted by Professor Van den Brink and Peled in the Memorial Sloan Kettering in New York that established that patients that have a decreased microbiome diversity at baseline before transplant, but also at neutrophil recovery, have a lower overall survival. So this was very important to see that in patients, for example, in patients with very severe acute myeloid leukemia, when you look at the microbiome, this is already predictor of patients' outcome. And in fact, when we look more in details, there seems to be a link between the risk of graft-versus-host disease and infectious complications, and also maybe with the risk of relapse of the underlying diseases. Therefore, this is important to manipulate the microbiome to improve microbiome diversity and improve patients' outcome. So what can we do? Of course, we can use some antibiotic-sparing strategies. So there is some strategies to decrease the use of antibiotics, or at least to avoid the use of antibiotics with the broad anti-anaerobic spectrum, such as piptazo or penem. We can also use some kind of prebiotics. In particular, it was recently reported by Pavan Reddy that you can use resistant potato starch that is safe. So it was only tested in 10 patients, but it seems to be safe and to increase, in particular, the butyrate producing bacteria in patients that have been associated with some protective effects. So this is some very preliminary data because we don't have any information if when you give this prebiotic to the patient, it will improve the outcome, but it seems to be promising. And the last things we can do now easily, this is the use of fecal microbiota transplantation, of the use of microbiotherapeutic product. And this is what we are going to do in the ongoing PHEBUS phase 2b clinical trials.